So let's say a man comes in and total testosterone levels are under 300, and they're also reporting side effects. Can you explain where treatment might head? What are some of the treatment options for low T?
Yeah, um, so they come in with a low T, they've got the symptoms. That means per the AUA criteria, they qualify as being T deficient. There's a couple things we have to do before that. So we have to try to figure out where it's coming from. So we'll usually draw a prolactin level, make sure it's not coming up from higher up in that what we call the hypogonadal axis, essentially how the body's responding to the T levels. We look at something called luteinizing hormone, which helps stimulate the testicles to make more testosterone. And one of the other things that we have to do, because one of the side effects of giving testosterone therapy is that you increase your blood volume and could run the risk of developing something called polycythemia, which could increase the risk of stroke or other conditions like that. We get what's called the hemoglobin and hematocrit. So essentially how much blood is in your body, because that will actually get affected by the testosterone levels. Once those are all done, then we can start talking about options for treatment.